Now, in the outset, I'm Dr. Lima Imchen, the Managing Director of BLK Medical Center, and my good friend and eminent spinal surgeon, Dr. Punit Dega, is here with me, and Mr. Abhidi Jain is the Deputy Manager of BLK-Max Hospital. Now, Dr. Punit Dega is a world-renowned and eminent orthopedic spinal surgeon who has had experience of more than 18 years in this field. We have been in collaboration with BLK-Max Hospital for the past many years, and BLK-Max has been sending doctors in the super specialty fields which are not available in Nagaland, like in the field of medical oncology, and in the field of liver transplant surgery, and of course our spinal surgeon, Dr. Punit, he has been visiting us very often, every month, and our patients are reaping the benefits of his expertise. In fact, many of our patients from Nagaland have, he has operated on them, and there are many success stories. Now, when our patients from Nagaland, like we don't have so many super specialties, so when our patients go outside for treatment, they feel alienated, like they're in a strange land, they don't know how to go about, especially in the big hospitals. So what I've experienced and the feedbacks from patients I've received so far is that like patients who have gone to BLK, they felt welcome and they don't have to run from pillar to post searching for doctors. And so far, so many positive feedbacks we have received about BLK and how our patients have been treated out there. In fact, one of our own, the son of the soil, Dr. Dimapur, he's a hepatic transplant surgeon, and he's been in BLK for past many years. So, as you all know, like you or one of your family members who go outside for treatment, you want the best treatment, of course. You want accessibility, you want affordability. So that's what we all look for. And with one of our own out there, like our patients, they feel comfortable and brave to go there for treatment. So this association, this collaboration with BLK-Max has benefited a lot of our people, and we hope to carry on with this for a long time. Now, Dr. Punit, he has operated, like I said, he has operated on a lot of our Naga patients for spinal surgery, and now they have come up with this new integrated robotic system of spinal surgery, which is very safe. And in fact, medical technology has advanced so much now, that this is a very innovative and very safe procedure which can be done. In fact, now spinal surgeries, you do not need to stay in the hospital for days after doing the surgery. You do it; it's like a minimal invasive surgery you do, and its blood loss is minimal. And I think for our people also, if we create awareness that these type of surgeries are there, then we can avail this kind of treatment. Now, accessibility and affordability, they are the two main criteria for these type of high-end surgeries. Accessibility, Dr. Punit is here, he can provide that service. Now, affordability is an issue for our people at least. So what we are doing in collaboration with our government is find ways to minimize the cost. And we are working with BLK-Max to ensure that the cost is kept at a minimum so that our patients can afford this kind of treatment. And in the days to come, in the months to come, Dr. Punit will also start doing some surgeries in our hospital also, spinal surgeries, so that the patients do not need to go outside Nagaland. So we're working on that also. So Without further ado, I'll hand it over to Dr. Puneet to elaborate on this topic. Thank you.
For a very comprehensive introduction of BLK-Max as well as our association that has been continuing for many years. I per se has been visiting as a part of BLK-Max for the last couple of years, and but for once here and there for various reasons the monthly visit has almost been there, and I had the opportunity to see a lot of patients in the Eden Hospital OPD, and as Dr. Lima has told, many of the patients had already tried all sorts of therapies and treatments who required surgery. They could avail of the best of the technology and the latest minimal invasive techniques for their spinal surgery back in Delhi at BLK-Max. So we are grateful for the trust as well as the faith that the people from Nagaland who have been suffering with spinal ailments have put in me, and other ailments that have been treated at BLK-Max by my colleagues in different specialties. Moving forward in spinal surgery, I think the major fear has been paralysis, prolonged bed rest, and the risk that people feel in their mind, which is more of a myth than a fact, that probably spinal surgery is not going to be successful. After having worked 18 years in spinal surgery alone and the last 12 to 13 years doing exclusively minimal invasive spinal surgeries for degenerative patients, I have seen the entire paradigm shift in spinal technology. I have seen per se the techniques moving from open to minimal invasive to robotics. I have seen the safety standards, means they are at par with any other surgical field today, and all those myths have been busted, and we are grateful to technology. So one further step, apart from all the latest neuromicroscopes and neuromonitoring techniques for monitoring the nerves during the surgery, one further addition which has made spine surgery even safer is robotics. And we at BLK-Max are pioneers in acquiring the world's fastest, most integrated robotic system, and what it gives us is an extraordinary ability to plan the entire surgery inside the operation theatre in the same position in which we are going to operate, and execute the entire thing, also see the outcomes in that very time inside the theatre by spinning our 3D C-arms around the patient. So from pre-operative planning till post-operative outcome, everything can be done inside the theatre. And not to mention that all of this can be done with smaller incisions, minimal invasive muscle dissections, and no or minimal blood loss. These modern technology and techniques have made spine surgery, maybe as Dr. Lima said, a little expensive, but I think today's world we are all talking about cost effectiveness. Doing a spinal surgery by traditional methods and the patient lying in the hospital for many days, sometimes weeks, not able to get back to work for months. The cost effectiveness comes into play when the patient we see walks the next day after surgery, is almost pain-free within a week's time, or if we have done a multi-level thing in a couple of weeks' time, he is able to go back to his work, his livelihood. So physiologically and psychologically, patient feels functionally much better than the traditional methods. So I think I would like to give you a small glimpse of this technology through a video and a few slides which I will show you of our initial few cases that we performed and the outcomes that we achieved.
Robotics, where experience of specialists meets technology of the future. A smarter and efficient way to improve mobility. Introducing India's most advanced integrated robotic system for spine surgery at BLK-Max Super Speciality Hospital. A comprehensive navigation capability to deliver accuracy in minimally invasive spine surgeries. An integrated imaging system to help the surgeon visualize, plan and navigate procedures in real time. A technology that allows for smaller incisions leading to minimal blood loss and minimal scars. A journey towards faster recovery and better patient care. BLK-Max, intelligent healthcare in expert hands.
So I have been associated with the BLK-Max Hospital for more than 13 years now, and I have seen the entire journey of spinal surgery evolving. Robotics is just the last feather in the cap of safety of spinal surgery. And I have seen it evolving from open techniques to microscopic techniques to endoscopic techniques to daycare surgeries. The patient comes in the morning, gets the disc removed, goes back home in the evening. For confidentiality reasons, I cannot name people, but I think at least I'm closing to 12,000 spinal surgeries with the minimal invasive techniques, and I think close to 100 patients from Nagaland in the last 1.5 to 2 years that I have been visiting, and some of them may be employees of this hospital also who have benefited, or their parents or their relatives who have benefited from minimal invasive spinal surgeries and technologies. And what spinal robotics has done is that it has taken that fear out of the mind of the patients because it is more objective outcomes now. It gives us that ability to do everything on a software, and this whole process is based on AI. As we know, everything that we do today, we talk about self-driven cars, we talk about the aviation industry, everything is today based on an artificial intelligence, and the human minds cannot match it. We cannot comprehend that amount of data in our head to visualize a picture what artificial intelligence can do. So spinal robotics is just an extended arm or a representation of artificial intelligence, one of the artificial intelligence in healthcare. As you see in radiology also, you must be knowing that artificial intelligence is allowing to report. Some of the centers like Tata Memorial, they are reporting 1,000 x-rays in a day with the help of 2 radiologists. Is impossible without artificial intelligence. So what robot is, the word robot is a Czech word which means forced labor. So we are still commanding it, we are guiding the robot what to do, but once we have fed all the data into the system, the comprehension is beyond our human mind. What is the need to embrace this technology? As I told you, there is a fear of paralysis amongst the patients. What robot does is increases the precision and accuracy to the spinal surgeries. To what extent, I will show you in my initial few cases. We are already reaching close to 100 surgeries in the next few months. But this data I also presented because this is what we collected from the initial 10 surgeries. So most of the robotics have the accuracy close to 98 to 100% in literature or data from all over the world. But most of them have been with the previous generation robots, because this generation robot which we have got is only close to 100 and 150 around the world, and in India this is the third one, but the one we have, the integrated one, is the first one. So this is our data so far which we have analyzed. We compared it with our spinal fusion patients without robot with a retrospective analysis, and all those patients where we did the robotic surgery. So an equivalent of 10 patients on either side. The mean age did match on both the groups. The gender equality was not something for an eye-raising thing. Total number of screws implanted in the robotic as well as the non-robotic cases were 44. These are the different lumbar levels where these screws were put. Just to understand how robot improves your accuracy. So most of the spinal work that you do with the robot is hardware work. It's not the decompression work, but the fixation work. Whether you put an interbody cage, or you put a pedicle screw, or the lateral mass screws in the spine. So this is the common classification that we use. If all of your screws are perfectly in place and there is no deviation, it is grade A. If it is a less than 2 mm deviation, we categorize as B, less than 4C, less than 6D, and greater than 6 is E. Just to understand that category A, B, C are usually safe, while D and E can be detrimental for the nerve damage. So, how does the accuracy work? So, if you see, this is like a bullseye on a dartboard. So, if you put your screw right in the center and score 100 out of 100, it is grade A. This is what you want to achieve. While you see how the grade B will deviate outside or inside towards the spinal canal, and similarly C, D and E. And as I told you, D and E are absolutely unacceptable due to the violation of more than 4 mm. So, in our open cases which were done without the robot, we found that our we have a lot of screws which were outside the A. They are not green. You see the one screw was in the orange B category, 2 of them were in the yellow category, but none of them, even without the robot, because of our experience for ages, none of them were in the detrimental category. But still the accuracy was suffering. When we analyzed our robotic data, we found all our screws at all different levels were landing in the A category. So that's the bullseye we can achieve with the robot and not possible without the robot. So we had 100% accuracy in what we did with the robot, while a 93% accuracy without the robot. So even though it may not look very bad, but a 1% inaccurate may be 100% inaccurate for that particular patient, and the outcome may have a serious hazardous effect on patient's life. When we compared the robot-assisted surgeries with our conventional techniques, we found that the blood loss was almost half as compared to the non-robotic. We also found that since all these surgeries were minimal invasive, there is no drainage required, while you will have to keep these patients in the hospital for 2-3 days because there will be a drain around and the drain has to be removed later. Hospitalization, which also affects the cost, has gone down from 4.1 days of stay. An average length of stay has come down to 2.3 with the robot. Time to independent ambulation was 2.5 days, now it's 1.2 days, where patient doesn't need any assistance, can walk out of the hospital on its own. The visual analog score is comparable for the pain because either of the techniques, you are removing the pathology or removing the disease, the patient has to find the benefit. Similarly, in the post-operative, preoperative assessment, the pain score was high, and post-operative pain score was even better with the robotic because of the minimal invasive technique and not because of the robot per se. And the accuracy has been 100%. The only flip side we found, but we have already conquered it in the last few months, was that we were spending more time in the theatre, and that happens with any new technology that you get your hands on. We have already surpassed that, especially in multi-level diseases. You plan it once and then you tell the robot it takes 20 seconds to put each screw. The same thing if you have to do looking at the Siam, each screw, it will take you much longer. Also, one big benefit of the robotic technique is that it takes away all the radiation hazard both for the patient as well as the surgical and the assistive team inside the theatre. Because all those procedures we have been performing without the robot with minimal invasive technique, our C-arm has been running continuously throughout the surgery. And especially a center like us where I have a huge team of spinal surgeons, I also have National Fellowship Board candidates. So every year we get another 2 candidates from National Diplomat National Board for doing super specialization in spine surgery. So those guys will obviously take longer and will also take more radiation doses as they learn. And since there is no previous data, this all minimal invasive spinal surgery is only 10 years and this robot is only 1 or 2 years. So the younger surgeons adopting minimal invasive without robot only will come to know after 15 years what radiation has done to their body. because previously the surgeons were doing the open techniques without any radiation. So there is no data today to prove what kind of hazard. We already have guys who are senior enough, have been using radiation in cardiac or in orthopedics, who have their thyroid issues and skin cancers, and the issues are cropping up, and they will suddenly crop up in the next decade. So this is the time that we felt to change, and we changed. Change is always difficult, but there is no other way that you can evolve or the science can evolve. You have to be a part of the road, otherwise you will be a part of the road roller. Can you play the last video just quickly? Just 45 seconds just to show you the process. This is our spinal suite, which is fully equipped with every technology that a safe spine surgery requires on this planet. You name it, we have it back home. So this is integrated approach. So the spinning of the 3D CM happens inside the operation theatre after you have these markers on the patient's bone. This is spun in the prone position. So if you compare it with the same thing with a pre-operative CT done in supine position, and then you change the position in the operation theatre, it cannot have the same accuracy. So after spinning, all the images are ported into the robotic software. The surgical team can plan it. It is a touch and drop. I can pick up the screw like this virtually, drop it and angulate it, push it forward, translate it, increase the size, the diameter, the length, whatever you want to play like a video game, you can play it and have a desired thing without actually performing the surgery. You are visualizing what it will look like after the surgery. So since you can visualize it and plan it and save it, you give the saved image to the robotic software, to the robotic executing arm, and followed by that, the robotic arm will lock in position to perform exactly what you have planned. And then you can use all high-speed drills for accuracy and faster evolution. And while you are performing it, you have a real-time image matching the planning. So the blue is the planning and yellow is the execution. So you see the overlay, exactly what you planned, you are performing. And if there is any deviation or error, the robot will give you a deflection or a red mark and will ask you to stop. And you can quickly check your process again on the software. If everything is okay, you go ahead. So that is the beauty of the robotic system. And I also visualize and look forward, as Dr. Lima has said, to performing a lot of minimal invasive and other surgeries at Eden Hospital as we move forward, since it's a long time we have been coming and a lot of patients are getting benefited. But I understand, as he said, affordability is always an issue, not just here, it's an issue everywhere. Unless the patient is insured fully or the insurance is able to take the entire cost, and there's also a challenge, all robotic procedures are not covered under the insurance, and for those I think the insurance penetration is very poor in our country, especially in Nagaland. So whatever benefits we can extend, I think Abhinay is our administrator that way, so he also takes personal care, whatever discounts can be offered, they are done. But I think the future lies in disseminating the technology, disseminating the techniques, and eventually taking it outside the central core of BLK-Max and making it reach everywhere.